100% of the time, and I hate the word co-occurring. It's all co-occurring. So what people mean by co-occurring is there's a substance use issue and there's a mental health issue. And so you have two things. I'm having a really hard time finding one that stands alone when it comes to substance use. Now maybe, and you do have some mental health issues out there that don't involve substances. We know those exist. When we get over here on this other side, substance use disorder, and I don't know if I've ever seen it, if I'm honest, because so much of addiction is driven by trauma. Physical, sexual, emotional abuse, big T traumas. And a lot of times those lead to mental health issues, post-traumatic stress disorder, anxiety, depression. And then the substance use disorder kind of gets its foothold in self-medication. And so when I look at it, I assume my patient has co-occurring disorders. I'll tell you where I've seen it. I've seen it in places that just treat one and not the other. Well, this person has this, and so we can't touch that. We deal with this, and boy, we've got to stop doing that because these things don't exist in silos. And so our best approach there, and when I came through, the approach was let's get them off everything and figure out if there's an underlying mental health issue. And that's not the approach anymore. I think the approach today is much better. Let's address both of them at the same time. And I think we can do that, and I think tremendous work is being done right here in Nashville at Vanderbilt around this issue. It's really hard to stay in recovery when you have an underlying mental health issue that's not being addressed. And I can tell you that even in my life, not addressing the big T trauma, mainly sexual abuse, nearly led me to taking my own life, and I was double-digit years deep into recovery. And so we have to address those. You don't have to be using substances to be struggling from that standpoint, and I found that one out the hard way.